With the number of COVID-19 cases continuing to climb, everyone was expecting new restrictions. Today there are 128 active cases in Gibraltar. There are 6 people in the Victoria COVID ward at St Bernard's Hospital. Perhaps more worrying, though, because of their age, are the 3 confirmed resident cases at the John Mackintosh wing. With 5 members of staff at elderly residential services also COVID positive, all visits to these homes have now been prohibited.
Well, look, it's a horribly difficult decision. Let me give you a little bit more data. The 3 cases are at the John Mackintosh wing, but the 5 ERS workers are not all in the John Mackintosh wing. I think there is one in Hillsides and one in one of the other facilities. There is no desire to exclude visitors. There is a deep understanding that, especially with people in ERS, you could be looking at last years of life, and therefore the visiting is an important part of the continued and final contact between family members. We don't want to limit that in any single way. That will not last one moment longer than the advice I am given that it is absolutely required.
Further curtailments on the freedom of gathering were confirmed. As from Friday, the number of people legally allowed to gather in a group will come down from 20 to 16. The maximum number of people able to sit at one table in a restaurant will be reduced from 10 to 8. Live performances of music at bars, restaurants or cafeterias will not be allowed. Last orders for alcoholic drinks will be brought forward to 11 p.m. Only 1 alcoholic drink per person at a table will be permitted at last orders. Any bars, pubs or clubs that do not have their own kitchen will be required to stop service by 9 p.m. and close by 10.
The main vectors for the virus are the home and the workplace. If you look at the CTB data, it's about 53% of the infections happen at home and in the workplace. That means 47% of the infections are at large. So controlling the home is not something that we can do by legislation. We've already given a lot of advice in that respect. Controlling the workplace is something that we're going to do through our designated COVID officers. And then what's left is the areas of common socialisation.
Specific rules have been drawn up for Chatham Counterguard, where the Chief Minister said some patrons had not been observing the rules. All restaurants in this area will have to close 1 hour earlier than elsewhere at midnight. Wearing of masks will be mandatory in the leisure area of Chatham Counterguard, except when sat down at a restaurant table. The Chief Minister said he did not expect organised Christmas parties to take place in bars and restaurants this year.
What we're trying to do is to say, right, we know that we have to impose some restrictions in this remaining 47% of vector of infection, and in that area which we can breach with legislation, we do it in a way that doesn't gear up 100% to closure, but allows something to continue to happen in a more restricted way. But at least something is happening.
You haven't introduced any new measures for gyms and schools. Can you say what role they are playing in that 47%?
We're seeing those infections, we're seeing the contact tracing, we're seeing bubbles taken out of the school, and we're seeing that that's working. Yes, we might have 9 cases here, 8 cases there, but we've got a school population of about 5,000 people, 4,000 pupils and 1,000 staff and teachers. So we're not doing badly in that context. We are controlling it. It's important that people who go to a gym be encouraged to continue going to a gym, but they should just do so in a way that is safe in the context of the spread of the virus.
In addition to these new rules, Fabian Picardo said it was strongly advised that over 70s stay at home as much as possible, that people wear masks in all public areas, and that workers in the private sector work from home whenever possible. He said new measures for people whose sick pay is affected by self-isolation would soon be introduced.
What we're saying in the private sector is, look, if you have to have an additional 14 days in this financial year and next because of self-isolation or because of COVID, the government will step in and add 14 days to your sick leave entitlement.
The Nightingale Field Hospital is to be ready to deploy within 72 hours if needed, and the additional critical care unit at St Bernard's within 24 hours.
I remain optimistic because we are the Gibraltarians. And the Gibraltarians, when they are united, will never be defeated. That's the reality. We have 2 huge challenges on the horizon, dealing with COVID and dealing with Brexit. We won't know the impact of the restrictions announced today for approximately 14 days.